Bald Truth Dental Politics Podcast News Alert. Brought to you by Dig-A-Palooza, continuing education event. More info at dentistryingeneral.com.
You guys have hard evidence that the people who fail these tests actually continue failing, correct?
Exactly. And I think, Bob, you've hit the point. When you get a reliable result, okay, I'm going to give you a story where a dentist failed the NERB 3 times, passed another exam, sued the NERB, said this was capricious and arbitrary because they passed the first time, they took another. When they did the discovery, they realized they failed the same section in this other exam, but the NERB required you to pass every section and they didn't. They averaged the score. Now, they said, you've demonstrated the validity. Okay, great. But they got a license because they took this other exam and the state accepted it. That's not the end of the story. They wanted to move to an ADEX state. This happened about 5 years ago. That same dentist, 30 years later, failed the same section on the ADEX exam given by other examiners who weren't even alive back when he took it, still doing the same things incorrectly. If you talk to dental boards and you look at disciplinary records, it is the same people over and over again. When we get to that question, that's the thrust of the differences. It's that 2% of dentists who've had problems either criminally or discipline-wise with the boards, or who were unable to pass a performance exam. That small 2%, that's the cohort that could participate in one compact and another. And the question is, do you want your state to take a look at those people first before you allow them to practice? Because I think we all understand we are not solving the workforce issues by a compact. There's only a fixed number of dentists. I don't know any place that has a surplus that's saying, my dentists want to leave and come and practice with your state, because Al Gay, when he was at the ADA years ago, studied that and found that licensure requirements does not determine where dentists go. Dentists go where they want to go and do what they have to do to get there. Now, should we have easier portability? Sure, we would all like that. As an oral surgeon, I can tell you, I had to take a clinical board, 2 of them, and one of them, I hadn't treated a patient for 5 years in dentistry and didn't have anything to do with what I did. I would have loved to have had the portability. Now we do for most states, as 42 states have licensure by credentials. So you can move just by credentials now through 42 states, as long as your record. It's interesting, licensure by credential laws have the same requirements. You can't have been convicted of a felony. You can't have had discipline. You had to have a clean record, practice at least 5 years, and then you can come into the state if you had the appropriate education and testing. I think it makes common sense to all of us.
Yes, absolutely.
For more conversations, visit dentistryingeneral.com.